Hi doctor, my name is Liang Yu and my group members are Shumais and Yuan Yi. For our topics is ethics issue in couple and family therapies, and for the specific topics we choose the gender sensitive in couples and family therapies. What is gender sensitivity? Gender sensitivity is a philosophy that has been built to help people overcome sexism's obstacle to personal and economic growth. It also contributes to the development of respect for people of both sexes. The gender sensitivity assists in determining which gender stereotypes are true and which are stereotype generalization. The following, I will show the video of example of gender sensitivity. The video is explaining about what is gender sensitivity.
Gender sensitivity. A patient is talking to his male nurse. All your vitals are fine for now. You will be better by next week.
Thank you, doctor.
I'm not your doctor. I'm the nurse.
Really? I thought only women could be nurses.
Why is that?
Well, women are better caretakers. After all, they usually do the cooking, cleaning and caring of the family. So wouldn't it make sense for them to take care for the patients and not to treat them?
That is not true. Men can be good caretakers as well. And to be good husbands and fathers, they should consistently help out around the house.
But shouldn't the husband have a higher salary than his wife so that he can support his family? Therefore, shouldn't men be the doctors?
That is not necessary. This job pays well and it helps me support my family financially.
I also feel women are more emotional, so they bond with the patients better.
Men can be equally emotional as well. It depends from person to person. Times are changing. Men can take care of the house and women can take care of the family finances. She does not have to rely on a man to take care of her anymore. The traditional roles of both genders are changing, and people can now decide which role they want to play in their family.
Ah, I see. I am sorry for my assumptions.
Ha ha ha, that is all right.
Gender sensitivity issues in couple and families should be magnified by everyone. It is very important in concerning gender sensitivities, couples and family therapies. For the first point, stereotypes of gender roles would impact family relationships in terms of satisfaction and happiness. By improving gender sensitivity in couples or a family, it can reduce conflict due to the gender roles and responsibility. Usually the conflict between the man and woman who is doing the housework, who is washing the dish, sweeping the floor, and who is going to work and who is going to earn the money. When both men and women have clearer view on gender sensitivity, they will have more understanding of each other's. Thus, it can really promote the gender harmonies. For the next point, solving family issues with gender sensitivity in the therapies will help both men and women recognize, reconstruct, and perceive their gender roles and what is beyond them. Therefore, they can place their roles in the family mutually. Once traditional views on gender roles are reconstructed, it will have improved harmonic relationship in couple of or amongst the family members. Being a counselor facing gender sensitivity issues in couple or a family, they are encouraged to practice to give feminist perspective and non-sexist perspective in the family therapies. For the first one, feminist theory is the extensions of families into theoretical or physiological discourse. It explores women's social roles, perspective, and desire in order to better understand the issues of gender equality. While the feminist theories are primarily concerned with social relations, it also examines gender inequality and the advancement of women's rights. While for the non-sexist perspective, is also a therapy that related to gender sensitivity in a family that should be concerned. From a non-sexist perspective, the counselor should question the family's stereotype roles and expectations. The counselor can easily fall into a implicit bias on gender roles which are affected by cultural and environmental issues. For a small conclusion here, it will be unethical for counselor to have preconceived notion or bias about gender roles that would affect the ways they offer the therapies or advice.
Hi doctor, my name is Yuan Yi and I'll be talking about the ethical view and ethical dilemma of the gender sensitivity.
Before Yuan Yi explain, I would like to ask some questions. We know that one's values and beliefs on gender roles are influenced by his culture, environment, and the family itself. Some family may be open-minded and some may be closed-minded on the issues of gender sensitivity and the gender role in the family itself. So here's my questions. What are the ethical concerns when counselors' values and beliefs on gender roles clash with the family's one?
So regarding to your questions, there is 3 ethical concerns that were found, where the first one, according to the ACA Codes of Ethics, the counselor's primary responsibility is to promote the welfare and respect the dignity of the clients. And regarding by the individual values, counselors values the diversity of their clients, trainees, and also research subjects. They are also conscious of their own principle, attitude, and also opinions and should refrain from enforcing values that are incompatible with counseling's objectives. The guidelines above of the ethics gives us a fundamental protections against the counseling, whereas we move on to the next ethical concern. The next ethical concern is that according to AAMFT Codes of Ethics, the therapist should offer professional assistance to clients regardless of their race, age, nationality, social status, disabilities, genders, and also state of health. Next, the third one, according to the IMMFC ethical codes, individuals and families members have the freedom to define their relationships and family groups outside the limits set by the culture or domain culture or the custom to the couple and family counselors. Next, move on to the effect of a counselor's own will pertaining to gender in counseling. So what should counselor do and how does it affect the counselor's own will? A counselor should consider gender role to understand the client's situation and also build up counseling interaction by doing that and to improve the view on gender roles. The counselors should be much more gender sensitive to help the families, partners, and also other individuals to reach their full potentials. And it is said that every family counselors are also gender biased. Third, we must aware of our own attitude as a counselor, where it influences the way how a person thinks and perceives things, whereas this result on our own self-reflections and also our understanding.
Hey Shamin, when the therapist engage in a family therapy session, what should they do if an ethical dilemma regarding gender sensitivity issues arise? Do you have any example of an ethical dilemma regarding it?
Hi Lan Yu, according to the questions that you ask, let me give you an example. So if a woman were physically and verbally abused by her husband, a counselor cannot assume that the woman can remain in a relationship with her husband because it is not the best option and it is not appropriate. So according to that, A counselor should be cautious and able to recognize gender assumptions and also any unfavorable things or feelings of the client during the counselor's discussion session. Whereas another point, a counselor also should ensure that they are being engaged in a trusting therapeutic environment where clients find solutions for themselves, for fairness, and for defending the rights and interests of others. And having gender-sensitive practice assures that the therapy session environment can serve as reflections of a gender-sensitive family atmosphere in which clients can develop.
Hi everyone, I'm Shumei. After you have understand what is gender sensitivity about and what are the ethical views and ethical dilemmas that are regarding the issues of gender sensitivity in a family therapy, so let's have a look on a case study which has a little bit related to these issues. So let's have a look on the case of Naomi. So here's the situation. The White family consisting of wife, husband, 4 children, and the wife's parents. So they have been involved in the family therapy for several months. During one of the sessions, Naomi, the wife, expresses the desire to return to her career as an athletic coach. This wish causes tremendous resistance on the part of every member of her family. So first, her husband expressed his thought by telling Naomi that although I admire your ambition, but I still want you to continue to be involved in my professional life. I just simply feel that if both of us were working outside of the home, it would put too much strain on the entire family. It's what the husband told Naomi, and then followed by the Naomi's parents. First, they were so shocked by their daughter's desire, and they view it as a selfish action. So they urged her to put the family's welfare first, because in their viewpoint is if Naomi returns to her career, she will put away the family's welfare, which is a very selfish action, being as a wife and a mother. So this what they have expressed to Naomi. And last, the 4 children also expresses their desire. So by telling by telling Naomi, which is the mother, mommy, I want you to be a full-time mommy to take care of us. I don't want you go to work. So all of these situations has led Naomi to undergo a great pressure, but she still seems to committed to following through with her professional plans, and she also aware of the sacrifices that would be associated with her going back to work. But she is asking for everyone in the family to make an adjustment so she can fulfill her professional dreams. However, she is convinced that her plan would not be detrimental to the family's welfare. So it sounds very sad, right? And after the therapist understand the whole situation, the therapist shows an obvious bias by giving no attention and support to Naomi's desire. And the therapist also not asking the family to consider making any basic adjustment. So this is the whole situations about Naomi.
Hi Shumei, let me ask you a question. So according to the case you referred, what are the ethical issues that you found?
Thanks, Wendy, for asking the question. So based on this case study, we could see that there are a few issues that are considered unethical. So first of all is the unilateral decision making by the therapist on the goal of the therapy. So in this family therapy, it has involved the couples, which is Naomi and her husband, the 4 children, and Naomi's parents. Suppose the therapy should attend to each individual welfare and the whole family's welfare. But from the case study, we can see that the therapist did not really give attention to Naomi's desire. Instead, the therapist more attend to the whole family's welfare. If the therapist making unilateral decision, it would lead to ethical dilemma arises. For instance, both the welfare and autonomy of individuals and the family system. So from the case study, we can see that the therapist has chosen the family system between these two issues. With the therapist's assumptions on the gender roles. So next, we are going to talk about the therapist's values and beliefs. So as we know that the therapist's values and beliefs are relatively important in the therapy sessions, this is because the therapist's values and beliefs will make an influence in issues with culture, race, and gender, etc., which impact the outcome of the therapy's goal. So based on the case study, the therapist's bias values on the gender role has generally influenced the therapy session, where the therapist is biased on Naomi's desire, and the therapist also showed a gender role stereotype. The therapist also has made an assumption that not supporting Naomi's is the best solution for Naomi's and the whole families. But according to Magdalene, she mentioned that family therapists are particularly biased in demonstrating less interest in a woman's career than in a man's career. So this has shows an unethical practice, okay, where the American Counseling Association's Codes of Ethics also did mention that counselors need to be aware and avoid imposing their values and beliefs in the therapy session. So from here we can see that the therapist's values and beliefs on gender roles has influenced the therapy sessions, and this has discriminated the Naomi's opportunity to return back to the career. So these are all above other unethical issues that we have found out.
But on the other point of view, they say that if the major concern and goals are on the other family's members, and Naomi's desire does not have a direct effect on the main goals, the therapists have the rights to decide which issue needs or needs not to be concerned.
Yes, Liang Yu, your point of view sounds interesting. If that's the circumstances, I may agree with you that the therapist may perform ethically on the issues of not supporting Naomi's desire. As according to the ACA Codes of Ethics, regarding the issues on multiple clients, just like the case study, when a counselor agrees to provide counseling service to two or more persons who have a relationship, the counselor clarifies at the outset which person or persons are clients and the nature of the relationship the counselor will have with each involved person. If that's the case, the therapist is performing ethically if we consider that Naomi isn't the client and her desire does not affect the main goal of the therapy. However, what I want to say is that this therapy in the case study still performing an ethical action where this therapy shows an obvious bias on Naomi's desire. On top of that, there's ethical dilemmas that in this Codes of Ethics. The Codes of Ethics did not mention specifically how should the therapist take consideration on deciding who should be the client or clients. After we have roughly discussed the ethical issues based on the case study, do you guys have any suggestions for the therapists and Naomi's family therapy sessions?
Based on the case study, we could see the whole family system have a bias or issue with gender sensitivity. For example, Naomi's parents think that Naomi is selfish. if she returned to her career. The children also thought a full-time mother is the best. Since the whole family does not aware of the gender roles biases, it is suggested that the therapist assess the feminist therapies for Naomi and her family members. With that, Naomi could have less burden from being a full-time mother, and she also could have a little time for her self-achievement by returning to her career. Regarding the issue of the bias performed by the therapist, it is unethical for a therapist to have a biased views on an issue. It may bring discrimination to the clients, and according to the CAMFT Codes of Ethics, the marriage and family therapist should not engage in discrimination on the basis of gender and etc. It is the therapist's responsibility to make an effort to accommodate the clients. Thus, it is suggested that the therapist in the case study to improve the awareness of their own value and belief. They are constantly self-evaluating and challenging their own belief and value.
Well, changing a viewpoint, if the therapist show bias and give more attention to Naomi's desire and thus insist the whole family have a feminist therapy for the problem of gender sensitivity issues on the family system, what are the potential ethical issues would be?
Regarding Rennie's viewpoint and her question, I have found several potential ethical issues in this situation. First of all is the therapy may have ineffective result for the clients, for instance, Naomi's husband, children, or even Naomi's parents. The feminist therapy may be unrelated to the current main goal or the current therapy that has been conducting. And according to the CAMFT and AACA's Code of Ethics, both did mention that the treatment plan needs to be planned together by the therapy and the clients. And they need to develop a treatment plan which is consistent with the client's goals and that offer a reasonable likelihood of clients' goals and benefits. Besides, let's say that most of the family members refuse to have the feminist therapy sessions. The therapist cannot insist or force the client to do so. Thus, it would be unethical if the therapist do so. According to ACA's Code of Ethics, the therapist also has to respect the client's freedom of choice when developing the treatment plan. However, the case study stated that the white family have been involved in family therapy for several months. So, according to ACA's Code of Ethics, the therapists and clients have to regularly review and revise the treatment plan in these few months of therapy. So thus, this could assess the client's continual viability and effectiveness. Let's say that the problem of Naomi's desire arises in the middle of the therapy is an issue that affecting the whole family main therapy's goals. Why not changing the therapy to feminist therapy? Then this may be more suitable and effective plan for the whole family. In a nutshell, we would like to share you what we have learned throughout this assignment. Regarding our topic, we have learned that being a family therapist isn't an easy task. Why do we say so? As we know that sometimes family therapist needs to deal with more than one client, especially when dealing with whole family members. So they have to attend to the whole family welfare and the welfare of each individual in the family. Let's assume that the whole family member have 7 persons. So therefore the therapist has to deal with 7 persons' individual welfare and plus the whole family welfare. So it is difficult for the family therapist to take care each of them and the whole family welfare. Besides, the family therapists are also supposed to stand in a neutral position to look at the problem when facing multiple clients in a therapy. But it is always difficult for a person to stay neutral, as we know that everyone has their own belief and values that keep on influencing themselves, and the therapists are not exceptional as well. They are also people. So here's the doubt. Can a therapist completely be neutral and without any influence of own values and beliefs when working with the clients? Last but not least, the codes of ethics for the family therapists are not as complete as other therapies, and this would lead the therapist to an awkward predicament when dealing with the ethical dilemmas that arises during the therapy. Throughout this presentation, you could see that all the codes of ethics that we refer to are more towards the ACA codes of ethics, because these ACA codes of ethics are more complete to the marriage and family therapist codes of ethics. And these are the reference that we use for our presentations. And we have come to the end of the presentation. Hope you enjoyed about it.